Welcome to This Explainer. Today, we're taking a literal trip through time to look at how fixing a broken bone transformed from what was basically a desperate gamble into an absolute marvel of biomechanical engineering. Seriously, we're going to trace this incredibly cinematic journey. We'll go right from the days when doctors could do little more than strap on a splint and just hope for the best, all the way to our modern era. An era where pioneers literally rebuild the human skeleton using principles ripped straight out of a structural engineering textbook. Let's dive in.
So, ask yourselves this. How exactly did we go from that passive wait-and-see approach to the ultra-precise structural reconstruction of the human body? I mean, for thousands of years, if you broke a major bone, the medical consensus was essentially just pull it straight, wrap it up tight, and pray it healed without some debilitating deformity. The leap from that kind of passive observation to actively opening up the human body to install titanium plates, screws, and rods, it's honestly one of the most dramatic, heroic leaps in all of medical history.
Okay, picture this. Imagine being a patient in this Vienna fracture ward back in 1913. Check out those complex systems of ropes, pulleys, and weights attached to everyone's legs. It perfectly captures the grim reality of the preoperative era. Back then, healing meant weeks or, honestly, even months strung up in crude traction. Doctors were literally just using gravity, trying to pull bone fragments into alignment. But, as you can probably guess, that prolonged bed rest usually led to severe joint stiffness, muscle atrophy, and a frustratingly slow recovery. For centuries, that non-operative management was really our only tool. Until about 1750, that was the absolute limit of what we could do. But, necessity is the mother of invention. Global conflicts like World War I and World War II forced some incredibly rapid innovations in surgical techniques. The massive influx of severe trauma cases practically demanded better solutions. And crucially, by 1945, the post-war era brought us widespread antibiotics and major advancements in anesthesia. All of a sudden, opening up a limb to fix a bone wasn't an immediate death sentence from infection or shock. The door to operative fracture management was finally, firmly kicked wide open.
Now take a look at this truly historic moment from 1902. This is pioneer Alban Lombaut's very first application of an external fixator. He was a total visionary who introduced the concept of stable internal fixation. And get this, despite intense skepticism from his peers, and sometimes outright hostility, Lombaut and his contemporaries boldly believed that fractures didn't just need to be splinted, they needed to be mechanically stabilized. By driving pins into the bone and connecting them to a rigid bar on the outside, he proved you could hold the bone perfectly still. That meant patients could actually move their joints way earlier than those poor souls stuck in the traction wards. A real game changer.
But the real paradigm shift, that happened in 1958. 13 Swiss friends and colleagues who were totally frustrated by the inconsistent results of fracture care got together and founded the AO Foundation. This group didn't just invent new metal plates, they literally wrote the modern rulebook for orthopedic surgery. They fundamentally standardized the entire philosophy of stable internal fixation. They realized that treating fractures required a highly structured process, one based on good science, sound technology, and really rigorous clinical studies. It completely transformed how we handled the shattered human frame.
And that revolution brings us to a core concept coined by Dr. Anand J. Thakur. In his seminal work on fracture fixation, he modified a famous medical quote to say, "As is our biomechanics, so is our orthopedics." It's a perfect reminder that a modern orthopedic surgeon is, essentially, a structural engineer reconstructing a broken frame. You can't just be a biologist anymore, right? To fix a bone, you actually have to understand the physical forces of nature acting upon it. You have to master materials, load-bearing capacities, and physical stresses.
So, to act as engineers, surgeons have to master biomechanical forces. Take the normal force, for example. That's the perpendicular push or pull you're seeing right here, which implants absolutely must counteract to stabilize a fracture. When a patient walks on a healing leg, the bone and the metal implants experience tension, compression, bending, and torsion. It's a lot. If the surgeon doesn't perfectly calculate how to neutralize those forces using screws and plates, the metal's going to bend or break, and the bone simply won't heal. It is pure, unadulterated physics happening right inside the human body.
Notice how an angled bone screw can actually be used to pull two broken fragments together. It creates compression directly across the fracture line. By squeezing the bone tightly together, the surgeon completely eliminates any micromotion. And here's the coolest part. This stability actually tricks the body. It bypasses the slow, bulky, cartilage-forming stage of healing and allows the bone to heal directly and rigidly. It is, quite literally, a mechanical hack of a biological system.
But, engineering isn't everything.
Over the last 3 decades, we realized something crucial. The 1960s approach of completely stripping the bone to place those plates, which was known as subperiosteal dissection, was actually destroying the bone's blood supply. Not good. So today, we've shifted to epiperiosteal dissection. What does that mean in plain English? We now protect the periosteum, which is the living, blood-rich membrane wrapping around the bone. Because at the end of the day, you can have the absolute best mechanics in the world, but without a preserved blood supply, that fracture will never, ever unite.
Now, when we combine that deep biological respect with advanced mechanics, the results are just staggering. Just compare the severe pelvis and femur fracture on the left with the pure mechanical beauty of the modern locking plates fixing it perfectly in place on the right. If you were to suffer a major accident today, this is exactly the technology that ensures you keep your mobility. These locking plates are a massive innovation. The screws actually thread and lock directly into the plate itself. That means the plate doesn't have to be squashed tightly against the bone, which preserves that precious blood supply we just talked about, all while giving incredibly rigid structural support.
And this biomechanical evolution didn't stop there. It led to advanced intramedullary nails, a concept pioneered initially by Gerhard Kunscher. Instead of slapping a plate on the outside of the bone, surgeons actually remount the hollow marrow canal and drive a titanium rod straight down the center. Then, they anchor it from the inside out with interlocking screws. It acts as an internal splint that shares the load of the patient's body weight rather than taking all the weight itself. It's an absolute biomechanical masterpiece, one that allows patients with completely shattered femurs to stand up the very next day. Honestly, it's mind-blowing. Fast forward to today, and this incredible century of medical heritage is being digitized and rapidly accelerated. Complex surgical approaches and biomechanical principles are now streamed globally on platforms like YouTube. It is totally revolutionizing open-access education for residents and trauma fellows everywhere. But we are also stepping into a wild new frontier. AI algorithms are actively being trained to identify super complex anatomy, like the notoriously tricky carpal bones of the wrist, right off a standard X-ray.
So the really crucial question to leave you with is this. As we've moved from those crude hanging weights in a 1913 hospital ward to the ultra-precise, minimally invasive structural engineering we use today, will artificial intelligence be the next great pioneer in our operating rooms? Like, will the orthopedic surgeon of tomorrow simply oversee an AI that perfectly calculates those normal forces, selects the exact ideal titanium implant, and maps out the absolute safest biological approach? It's a fascinating thought to ponder as we watch this incredible medical evolution continue to unfold. Thanks for joining me on this explainer. I'll see you next time.